heard of rhinoplasty or plastic surgery on your nose. This procedure is commonly used to reconstruct the nose for facial enhancement. But in some cases, doctors can help people with breathing problems or those who are completely missing a nose. Dr. Samuel Lamb from Lamb Facial Plastics is one of those doctors. He is here today to talk more about the benefits of rhinoplasty. Good morning, Sam. How are you?
Good morning, Amy.
Always good to see you.
Nice to see you as well.
Okay, let's talk about rhinoplasty.
All
This
right.
is a very artistic plastic surgery,
Not
I would say.
autistic, but artistic.
Right, there's difference.
I'm going to start with a little bit of example to help people understand this. Hopefully it won't confuse everyone. Look, Ben, can you call up the first image here? What we're showing here is a glass of water, and you can see that it has a certain size, but you don't have a point of reference. So if you put another glass of water up there, next one, it now looks smaller, and that's the idea of harmony. We're going to talk about harmony. Now, the next slide, and now all of a sudden looks big. So let's use some images of noses to help people understand this. If you look, the tip looks small because the bridge looks big, but afterwards there's harmony there, and that's really what we're trying to do. Next image. This one, the tip actually looks very big, but when you add a little bit of augmentation to the bridge, the tip actually looks small. I did nothing for the tip. Next.
Wow.
And this is what's called the tension nose, where the whole nose is too big, so the whole nose is brought back into alignment with the face. Next one. And this one here, the tip is big and wider, and the bridge is small. So now you bring both into alignment, and there's harmony now.
Unbelievable before and after results.
Oh, we're ready for the next section. We're going to talk a little about trauma here. And if you look, this is just a standard traumatic nose where the nose is bent to one side, and this is realigning the bones. Next slide. And what we're trying to show here is a little bit more complexity, because this is the mother came to me and asked to repair a hump, and actually it's what's called a saddle nose from a hockey accident, and you can see that's collapsed. So I rebuilt the bridge so that it would be in alignment with the top of the nose.
These are unbelievable. It's so great to see before and after pictures like this, because that's when you can see these dramatic results. Someone first comes to you with some kind of issue. Maybe it's just for cosmetic reasons. We'll talk about that reason first.
Right.
How do you assess exactly what you need to do to create symmetry and harmony?
Well, it's all in the eye. I mean, I don't really have measurements per se. I'm really looking at the whole nose and how it works to the face, and that's so important. You know, I'm a specialist, and the real key thing I want people to understand is that this is really what I do. I mean, I do difficult noses. I put noses that don't even exist on the face and put it back on the face. You can see that some examples on my website. And really, it's an artistic eye. And the difference coming to someone like myself who does this all the time is that not only can I handle difficult, cosmetic problems, I can deal with difficult breathing problems. In addition to that, difficult noses that have been done before, and really the full gamut of rhinoplasty. And when people come to me, there's really almost no recovery time. I mean, there's really very little swelling, almost no bruising in majority of cases, and really no discomfort whatsoever.
That's a big plus. Recovery time is what people why they shy away from surgeries like this in the first place. And to hear that there's minimal pain and minimal recovery is a big plus.
Yes.
Do people actually come to you and bring in pictures of noses that they want?
Not so much all the time. Most of the time is just trying to understand how that nose works with their face. And so they come in with maybe some preconceived notions about what rhinoplasty is all about, but what I try to do is make sure that nose would work well with their face.
Okay, so sometimes it's cosmetic reasons, and like we saw in these earlier pictures, sometimes it's because of some trauma, an accident of some sort, or cancer.
Yes.
You can actually reconstruct a nose that has some damage to it.
We're going to show some reconstructive images. If we can, the next slide up there. I call this sort of the Michael Jackson, and you can see it's really been over-reduced. The person couldn't breathe, and really this is both a cosmetic and a functional result, so she can breathe, and this is way too much reduction of the hump. Next image. Joni is here with me today, and she's going to talk about her results. And the nose was really just too upturned, and she couldn't breathe.
Now, these are noses that they had work somewhere else that did not turn out as they desired.
That's right.
And they were really difficult in breathing and other issues.
And I brought the nose tip back down in alignment and really aligned it. It was too buckled onto itself.
How scary for someone to come into you after going through a procedure that wasn't favorable, and to have this done again? It must be so overwhelming to a patient.
The nose is something that you have to trust the doctor incredibly for.
Sure. I mean, it's something that is right out there for the world to see. And certainly if you're having physical problems using your nose, such as breathing, that can be really scary.
That's right.
Well, you've brought with you Joni today. Hi, Joni.
Hi.
Good morning to you. Welcome to Good Morning, Texas.
Thank you.
So this, we just saw, the last still was of your before and after. Tell us about your experience.
It was great. I was very apprehensive for my previous surgery.
Sure.
But when I walked in the door, his nurses and staff were very soothing and calming. There was no waiting. I went right in. Afterwards, I had no bruising at all, which I was shocked from my previous one. So that was great. And a week later, I started a new job.
That is unbelievable. And you started a new job too, which is like
breathe now.
And
you
I
can breathe
right.
now. I mean, I'm looking at your nose and it's just the cutest thing ever.
Oh, thank you.
It looks really
Thank you.
good. I'm sure, like you said, I'm sure that was really overwhelming for you
It
to go
was.
from a bad experience to go in and trust someone new.
Yes.
But your nose functions as it should.
Yes.
And it looks great too.
Thank
so
you. I can breathe a lot better.
That is excellent. All right, well, Dr. Sam Lamb, thank you so
very
much
much
for being here and educating us on rhinoplasties. So often we have questions about it and we're just afraid to ask. And you've certainly given us that information today.
Amy.
Thank you so much. For more information, you can log on to lambfacialplastics.com or call 972-312-8188.